U.S. President Joe Biden has announced the first ever White House initiative on women's health research as the state of women's healthcare in the country comes increasingly under the spotlight. Kate Fisher reports on so-called medical misogyny. That's a concept that acknowledges ingrained gender bias in the healthcare system. Now, a warning that some images in this report may be disturbing.
Pass it to me real quick.
Playing with her son Rio is one of Kimberly Turbin's great joys. But his birth left her severely injured and traumatized after the doctor administered a procedure against her will.
He walks in with scissors in his hand and says that he's going to do an episiotomy. I said, why? We haven't even tried. He said, why? Because I am the expert here. That's why. I said, okay. So then he comes towards me with scissors again, and I say, no, 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 don't cut me.
Kimberly's sister and mother were filming the birth, so the whole incident is caught on camera.
That's my No sale porque está grande la cabeza. Okay, yeah. Why can I do it? You can go home, do it. You'll go to Kentucky.
Kimberly says she feels her trauma was dismissed because her son was born healthy.
It didn't matter what the mother felt or what the mother meant through. It didn't matter being a healthy mother. Is that you have a healthy baby, but how could you give a healthy baby continuous health if the mother is not healthy? Come on, real. Everybody wants to just say that I have a healthy baby, everything's fine. I was not fine.
Kimberly's experience goes against the clinical guidance from the US's professional body, the American College of Obstetricians and Gynecologists. ACOG says it advocates for a patient-centered approach, where decision-making is shared between a patient and their healthcare professional in a way that centers the patient's values and priorities and doesn't reflect a clinician's biases. Maternal fetal medicine specialist Dr. Emiliano Chavira prides himself on doing just that. But he says that the way doctors are trained means that many of his colleagues are focused on the end result rather than the patient.
That's not really part of our training as physicians. Like what's hammered into us is getting the good outcome, getting the good outcome. But the good outcome is defined by very physical parameters, right? Was there a hemorrhage? Was there a vaginal laceration? Was there a fever? Did the baby end up in the NICU? It's not so much part of our training. Did the mother feel listened to? Did she feel empowered? Was she inappropriately scared in some way? Like those are not really elements of our training, and so much less on our radar.
But now it's on the presidential radar.
I didn't realize how much incongruity there was and how imbalanced it was.
Joe Biden's just signed a presidential memorandum to establish the first ever White House initiative on women's health research. It tasks federal agencies to recommend concrete actions on improving research into women's health within 45 days, calling on them to identify where investment will be most transformative in areas from heart attacks to menopause. First Lady Jill Biden will lead the effort.
Women deserve better.
Kimberly Turbin may not have the power of the presidency behind her, but she is working to improve healthcare for women in her community so that nobody else has to go through the same trauma that she did. Kate Fisher, CNA, Los Angeles.